Good afternoon, and thank you for joining us in today's webinar. My name is Dr. Caitlyn Donaldson, and I'm a Research Associate here at Cardiff University. I'm going to talk about the national findings from the Student Health and Wellbeing Survey that many of your learners will have participated in at the end of last year and the beginning of this year. So first of all, we're going to have a look at who participated in the survey. We had over 32,000 learner responses, which represents nearly a quarter of learners in years 3 to 6 in Wales, so it was a really good response. Numbers were slightly higher in the older age groups, with over 9,000 responses in year 6 compared to nearly 7,500 responses from year 3. 354 primary schools participated in the survey, which makes up 29% of all primary schools in Wales. Again, a really good rate of participation. Schools with low, medium and high levels of free school meal eligibility were represented. 21 out of the 22 local authorities in Wales had participating schools. And to account for differences in participation by local authority, we've weighted the data to ensure that it's representative. This means that the estimates have been slightly adjusted. The survey included questions on a number of different topics, which you can see are listed here. So they include mental health, bullying, healthy eating and physical activity, school connectedness, which is about relationships with peers, relationships with teachers, pupil voice, and how learners feel about school, electronic devices, school transition for year 6, and sleep. And what we're able to do is look at how the findings are shaped by different learner characteristics. These are age, for which we use school year, so years 3 through to 6, gender, which is based on a question in the survey which asked learners whether they are a boy, girl, or if neither word describes them. We had fewer than 600 learners out of the 32,000 stating that neither word described them, which made up less than 2% of the overall sample. Therefore, it's important to note the small sample size of this group when looking at findings, as this may make the estimates less precise. The remaining learners were evenly split between boys and girls, with over 49% of learners in each category. Finally, for learners in years 5 and 6, we included questions to assess family affluence. Family affluence is measured using the Family Affluence Scale, which is a validated research tool and asks learners about their home environment. For example, questions include whether they have their own bedroom or if they have a dishwasher. These questions help to create a score that can be used to group learners based on low, medium and high levels of family affluence. It's used to help understand socioeconomic differences in health outcomes. So what I'm going to do is go through each of these 7 categories and highlight the main findings from within the national report, also looking at findings broken down by age, gender and family affluence. As time is short, this will only be a brief overview, and I would encourage you to look at the full report when it's made available online so that you can get more details. So the first topic we're going to look at is mental health. To assess mental health, we use the questions from the Me and My Feelings questionnaire. There are 10 questions about emotional difficulties and 6 questions about behavioural difficulties. We can use the scores to assess whether a learner has elevated or clinically significant difficulties. We found that 1 in 7 learners had clinically significant emotional difficulties, and when you add in those with elevated difficulties, this made up 27% of all the learners who responded. For behavioural difficulties, 8% had clinically significant difficulties, rising to 14% when elevated symptoms were also added in. We found that emotional difficulties tended to be higher in girls than boys, and behavioural difficulties higher in boys than girls. Learners who did not describe themselves as either a boy or a girl had the highest rates of difficulties within the gender grouping. For family affluence, mental health symptoms tended to be more common among learners from less affluent families. We also looked at life satisfaction and found that while 2/3 of learners reported high levels of life satisfaction, levels decreased as children moved from year 3 up to year 6. The next topic that we asked learners about was bullying. We asked learners whether they'd taken part in bullying in school in the past couple of months, or whether they'd been bullied at school in the past couple of months. 1 in 7, 15% of learners said that they had taken part in bullying, and nearly half said that they had been bullied. We also asked year 6 learners about cyberbullying and found that 9% said that they had taken part in cyberbullying and 28% had been cyberbullied in recent months. All bullying outcomes were more common in boys than girls and in learners from less affluent homes. So the next category that we're going to look at is healthy eating and physical activity. Learners were asked about their fruit and vegetable intake, as well as frequency of exercise, and this was described as exercise that left them out of breath and sweaty. We found that fewer than half of learners reported eating fruit and vegetables every day, and girls and learners from more affluent homes were more likely to report daily fruit and vegetable consumption. Fewer than half of learners reported exercising at least 4 times per week, and in this case it was boys and learners from more affluent homes who were more likely to report higher levels of exercise. So as I mentioned earlier, the questions on school connectedness included questions about relationships with teachers and peers and involvement in school life. We found that most learners rated their relationships with school staff and other learners positively and said that they had a say in what happens within school. However, less than half of learners said that they like school a lot, and this decreased from 2/3 in year 3 to just over 1/3 in year 6. A lot of the school connectedness questions were only asked to years 5 and 6, so that the survey wasn't too long for younger learners, but we can look at the differences in responses between these 2 year groups, and we found that learners in year 6 consistently reported lower levels of school connectedness than those in year 5. We also found that girls tended to report slightly higher levels of school connectedness than boys, although it did vary depending on the question. School connectedness, however, was one of the few areas within the survey where children with lower levels of family affluence tended to have similar responses to those with higher affluence. So this means that we found little evidence of socioeconomic differences in school connectedness outcomes. We asked learners in year 6 how they felt about transition to secondary school, whether they were looking forward to it, and also whether they were worried about it. Most year 6 learners, so 63%, were looking forward to transition to secondary school, and boys tended to be looking forward to it more than girls. But a large group of young people, 42%, were worried about transition, and these were more likely to be girls than boys. There was also evidence that young people from less affluent families were more likely to be worried about transition and less likely to look forward to transitioning to their new school. Most learners reported owning electronic devices, which were used for both entertainment and social connection purposes. Ownership of electronic devices tended to be more common in more affluent families, with the exception of smartphones, where there was little difference between groups. While use of devices for entertainment was common across age groups, use of devices for social connection, such as talking to family and friends, increased substantially with age. We also saw evidence that social media use increased rapidly from year 3 to year 6. In year 3, 1/3 of learners reported using social media sites or apps, and this increased to 2/3 in year 6. Okay, and then the final topic to report on out of the 7 listed is sleep. And we asked learners what time they go to bed when they have school the next day. We found that 2/3 of learners reported a bedtime of 9 p.m. or earlier, while 20% reported a bedtime of 10 p.m. or later. Boys and learners from less affluent families were more likely to report a bedtime of 10 p.m. or later. We also asked learners whether they ever have difficulty sleeping, and we found that nearly 2/3 said that they had problems sometimes or always. Girls were slightly more likely than boys to report problems sleeping, and learners who did not identify as either a boy or a girl were most likely to report problems sleeping across the gender groups. Children with high levels of family affluence were least likely to have problems sleeping, but we found little difference by age. Okay, so just to finish off, I'm going to give a summary of the findings broken down by gender, age and socioeconomic characteristics of our learners. We found that for gender, learners who identified as neither a boy nor a girl had poorer outcomes for nearly all of the questions. Boys had less favourable reports for behavioural difficulties, bullying perpetration and bedtime, while girls had less favourable reports for emotional difficulties, worrying about school transition and exercise. There were clear age gradients for life satisfaction, liking school, use of social media, bedtime and electronic device ownership. And for socioeconomic characteristics, we found that learners from less affluent families reported less positive outcomes for mental health, bullying, healthy eating and physical activity, transition, and also for sleep measures. However, there was little difference in social connectedness reports between groups. So that's everything. Thank you so much for your time, and I hope it's been helpful to hear about the national findings. The national report will be made available soon on the SHRN website.
Good afternoon and welcome to this section of the webinar, which is the primary SHRN wider engagement work. We'll be looking at some of the qualitative work undertaken in the last academic year and also discussing the final stages of the qualitative work. Phase 2B of primary SHRN was involved in exploring with non-mainstream settings the acceptability of introducing a survey like SHRN into special schools, PRUs and also EOTAS providers. This concentrated on developing the accessibility of the survey and the network and considering the current accessibility for learners with ALN. In order to do this, we held focus groups with 2 special schools, 3 pupil referral units, and undertook interviews with 6 policy and practice stakeholders. We also did focus groups with 4 SHRN secondary schools and invited the ALN co's to join in order to give us an overview of the challenges faced by some learners with ALN undertaking the survey. From the interviews with non-mainstream staff and stakeholders, we discovered that non-mainstream settings are data-rich and data-driven. The data collected is child-specific and child-centred, and this reflects the complexity of needs within the learner population. There was interest from participants in joining a research network like SHRN. However, there were concerns on how all students would be able to access a survey in its current form. This led to further discussions on how a survey could be developed to reflect the overall population of these settings. There was the acknowledgement of the need for rigorous data, with many settings listing different types of data capture that weren't necessarily evaluated or used. There was also difficulty with accessing some groups. For example, some learners in PRUs attend only on a part-time basis and then return to main secondary schools. Also EOTAS and home learners, and the discussions around how these students would be accessed. In the focus groups and interviews for SHRN secondary schools, we included input from the SHRN leads and the additional learning needs coordinators. We were also able to invite feeder primary schools to give their experience of running the survey with younger pupils. The overall consensus from the SHRN leads and ALN co's was that developments were needed to make the survey more accessible. Examples were given of some students running out of time or struggling with some of the more complex language in some of the questions, meaning that students did not complete the survey and their data was unable to be captured. Teachers were keen to include all of their students in survey activity, and were keen to be further involved in making the survey more accessible. What happens next? The team will be using the learning from the mainstream school interviews to consider how the SHRN survey can be developed and made more accessible for all learners. We'll also be discussing further work to investigate how surveys and data capture are used in non-mainstream settings, and this is an area that we're very keen to explore. We'll also be undertaking further research into how primary schools are responding to the survey and the reports after the survey rounds in the last academic year. This will include discussions with primary staff around the needs of learners with ALN and also younger students. We'll also be working with Welsh language schools to discover more about how learners access the survey in Welsh. The first two waves of the survey suggested that learners using the Welsh language version took longer to complete than those using the English. We've received feedback around the translation from English to Welsh and how some of the overly formal Welsh language used could be a barrier to completion. We have discussions planned with Welsh medium schools on how accessibility can be improved for learners using the Welsh language version of the survey. Thank you for listening. Please do feel free to drop any questions into the chat and we'll address more questions at the end of the webinar. Thank you.
So finally, I'd like to share with you our survey plans for the remainder of our feasibility study in 2023-24 and look ahead to our future plans. All schools who have taken part in the 2022-23 student survey have been invited to now take part in the School Environment Questionnaire, and that will have been sent out to schools at the beginning of this week within an email. The questionnaire is completed online by a nominated member of the school leadership team, and it aims to capture school level priorities and programmes which are aiming to support learner health and wellbeing within your schools. So data collection is currently live and questionnaires can be completed from any time now up until the 22nd of December this year. Following data collection, we'll look to produce a national summary of school environment questionnaire data, which will be available online next year. And we'll also have the ability to link the school environment questionnaire data with schools' pupil survey data through a linked ID. And that will help us to explore associations between school level priorities and actions and also pupil health and wellbeing reports. We also plan to undertake consultation with schools and learners, this ongoing work to ensure that we can refine survey methods and content for future use. Following the completion of the feasibility study next spring, we plan to integrate our network activities across secondary and primary schools as we currently prepare a funding proposal to support this through Welsh Government. And we plan to run surveys alternatively on a biannual basis. So for example, the next student survey and school environment questionnaire would take place in the autumn term of 2024 amongst all primary schools. And data collection is currently taking place within secondary schools. And all of this work will continue to be coordinated in partnership with Public Health Wales, so the health promoting schools teams are able to support schools in terms of how best to use the data. So whether your school has taken part in a survey or plans to, there are many benefits to becoming a member of SHRN. So you'll be joining hundreds of professionals and practitioners all working together to make a real difference. So the benefits of being a member include regular e-news in which you have updates on network resources, briefings, invitations to events, and also opportunities to take part in wider public health research. So please do get in touch with the email shown here if you would like to hear more about this opportunity. So finally, on behalf of the Schools Health Research Network Primary Expansion Sub-Team shown here, and many of which I'm pleased to say are joining us today online, I'd like to say a big thank you to our funders at Welsh Government and very much to yourselves for giving up the time so that you could join us today. Diolch yn fawr.